Hey y'all, Dr. Maka here. So the O shot. Let's talk about the O shot. So this is on a vaginal rejuvenation post. Vaginal rejuvenation basically has to do with things you can do to help with, incontinence, stretching, laxity, toning, lubrication in our lady parts that can happen over time, menopause, medication induced. Seen some patients who've had it from chemotherapy, but also with childbearing and vaginal births, right? And so the O shot is a part of that, in terms of one of the offerings. And this is what it means. So O shot is kind of just how it sounds. The idea is an orgasm shot, right? And so the O shot, how it works is you actually draw someone's blood. So you go to someone's arm, right? You draw blood just like you're doing. And then once you get the blood, you actually put that in a centrifuge, which is basically a device that spins at really fast speed. What that does, it basically causes a gravitational pull to kind of pull certain things down and certain things up. So you do that, you spin it down, and what happens is you extract what's called the platelet-rich product. So the platelet-rich product is basically all the cells that rush to an area in a time of injury. So this is PRP. So PRP is something that has been used in joints for healing, y'all, in scalp for hair loss. So it has a very restorative function. So what it does, and what I do when I do the O shot, is I actually inject the O shot in and around the clitoral area, which is the area of stimulation for women. I also inject it in the anterior 2/3 of the vagina, which is actually the G spot. The G spot is if you have internal orgasms, the G spot is kind of where you kind of have that orgasm, is right in the anterior 2/3 of the vagina. So I inject it in both places. The idea is basically to awaken things, awaken cells, recruit fibroblasts, recruit collagen, to build up that area, right? Think about it like fertilizer for your lady parts, right? Because over time, like, you can lose stimulation, right? Over time, as we age, menopause, stretching out, the nerves can get a little bit injured from pregnancies, from deliveries, again, time. So there's so many things that change down there. We don't talk about it a lot, y'all, even though we talk a lot about everything else, like facial rejuvenation, facelifts, rhinoplasties, tummy tucks, lipo. We talk about that all the time, but we don't talk about our lady parts and how there are things that can be done to enhance your experience, but also to help with incontinence, because a lot of these treatments help with incontinence that I talk about on this original post. But that pretty much is the O shot. Now it lasts about a year, so I'll generally repeat about 12 to 18 months. I can tell you what, in general, kind of how, the injection and the process is. Everything's numbed up with cream, so you don't really feel it. Overall, it can cause to increased orgasmic potential, but also increase the frequency of orgasms, the climax, or how high your orgasm can get. So those are things it can do. Nothing's a guarantee, right? But it's all about what your body does with what it's given in terms of the surgery. So I hope this helps answer that question. Great question. All right, catch y'all later.